Welcome to Thoracic Outlet Syndrome. We're going to go through some techniques, but what we're actually going to try and do for you today is explore how this particular peripheral nerve entrapment manifests and how it starts. And from a soft tissue point of view and a trigger point of view, there's a couple of different modalities that we can use to treat this condition. Now, the first thing that we should always do is look at exactly where about the entrapments are. So 9 times out of 10, we will have an entrapment here in the lateral part of the neck, and then there'll be a secondary one basically where the pec minor comes in as well. We do very now and then, we will get a third entrapment in and around the front of the shoulder as well, and then most possibly down here in the elbow as well. So there's 3 particular sites in the elbow that can also be involved in thoracic outlet syndrome. But the one that probably we see the most is obviously the scalene syndrome, where we've got the scalene muscles, which are the lateral flexors of the neck. So what we'll see is the anterior and the medius muscle. These are the 2 muscles where the entrapment site begins. Okay, so the brachial plexus pierces through between those 2 muscles. It then comes down underneath your clavicle, okay, your collarbone, pierces underneath here, then underneath your pec minor. It comes out to basically the front part of your shoulder, and then they split off in all their different directions. Okay, so there are areas in and around the shoulder where it can get entrapped, but it's a lot less likely. So in terms of treatment, my go-to here is always hands-on soft tissue work, but I think for a lot of therapists they may be just a little bit too aggressive. Okay, so if we use the NAT approach in treating these muscles and these trigger points, it really is a matter of sourcing where the trigger point is first, then holding it and letting it subside. So it's quite simple. So we've got Ali here today, and we've just got her in a little bit of lateral flexion, and we've also got her in a little bit of rotation as well. So we're going to come down, going to use the fingertips, and we're going to come down along the length of the anterior scalenes, which is basically right tucked in behind your sternocleidomastoid. So we're coming down, and as we get towards the clavicle, it's down here that you'll find the trigger point. So I'm running over the fibres there. You feel that, Ali? Mm-hmm. This is where the trigger point will lie down through this area here. Now, what's really unusual about these trigger points is they refer into the front of the chest, basically in between the shoulder blades, and then possibly down the arm. They actually feel like a neural entrapment, but it's actually the trigger point, so it is quite unique. So just holding this area here, every now and then just rocking the head backwards and forwards, holding that as it dissipates. Now what you'll probably find is they might get a little bit of pain going into that chest, as I said, maybe between the shoulder blades, and then obviously down the arm. So we gently just hold that, work that, wait for it to subside. Now if you feel a pulse, you probably need to get off it, because that'll be the artery in that area. Okay, simply come back, roll off the anterior onto the medius, and slide along and do exactly the same. Okay, so the trigger points will be in this lower half once again. So you're going to be pushing the muscle back into the spine itself and just holding that there. Okay, so once again, just roll backwards and forwards, pick up that trigger point, holding it there, and just let it subside. Okay, once we've established some treatment through that area, offloaded those trigger points, then we can start to open it up and put it on a bit of a stretch. Start to do a little bit of passive release tech. So just very gently move the neck as you slide along the length of the muscle. Okay, so this is not rocket science stuff, but it makes a massive difference if you treat them right. Now, if we go to the second entrapment site, which will basically be right across here, which is the pec minor. Okay, so the pec minor, it's a small muscle. It is very prone to shortening. It attaches to your coracoid process, so as it shortens, it obviously then pulls the scapular and anterior fascia. Okay, the brachial plexus runs underneath there, so once again the trigger point's going to be about midway through it. So it's actually really simple, just to come in with basically a braced thumb and just holding that trigger point in that area there. So you'll probably feel that as I run over there. So coming backwards and forwards over that. Like so, and once again it's a matter of holding that as well. Now, with pec minor, there's always the opportunity that you may reproduce some of the arm pain that goes down there. So that will be the really strong neural referral. You'll probably get that more from treating pec minor than you will with scalenes.